Kia ora everyone, and welcome to part 2 of our Dementia MedTalk. Today we welcome back Dr Diana North, who is a general practitioner with a special interest in the care of older people. In this particular MedTalk, we'll be talking about optimising the management of dementia. Welcome back, Diana.
Hi.
Now, just to start off with, what advice can you give us primary healthcare practitioners in discussing the diagnosis of dementia?
You know, the diagnosis of dementia is a big diagnosis, and the patient will feel really worried about this. Remember, normal people do get forgetful. And really what we need to do here is to reassure the patient, look at other issues that may be affecting their memory. If the person has early or mild dementia, and that is what we primarily see in general practice, our focus is on their instrumental activities of daily living, their ability to do complex tasks, to remain independent and in the community. So we're there to make a diagnosis, to talk about the supports that are available, and to set up monitoring as you go forward. There will be a small percentage who will have moderate dementia. They will often be starting to have problems with their activities of daily living, their ability to dress themselves, their ability to control their bowel or bladder. Once we're in this situation, we also have to look at those behavioural and psychological symptoms of dementia. That's when patients start to wander or can become more irritable and confused. To look at those, to look at their nighttime activities, to see what sort of impact that dementia is having on their life. For these patients, we often need to order a needs assessment, and we need to be looking at aged residential care for looking for placement. So what is my role? My role is really to diagnose and then support the patient and their family on this journey.
Once you have diagnosed dementia, how do you progress?
So the first thing I need to know is this a typical or an atypical dementia? Am I going to require CAT scans, MRIs, and am I going to need specialist support? With typical dementia, these patients will often present with a slowly developing memory loss over time. They don't have neurological symptoms or signs. They don't have behavioural changes, usually until it's later on, or major personality changes. With this group, I'm usually going to manage them in general practice. The atypical group usually progress much faster. The dementia can come on earlier. I'm looking for neurological symptoms and signs. The two commonest ones is Lewy body dementia, where the person can present with hallucinations, delusions, nightmares and Parkinson's, or the frontal temporal dementia, and these patients can present with inhibition, doing activities that they normally wouldn't do, but also with significant speech or language issues. These are atypical dementias. They often present earlier. In the person's 50s or 60s, they do require specialist referral and follow-up.
Are there any red flags that we need to consider in typical and atypical dementia?
There certainly are. We need to think, is this an early onset dementia? Is it a rapid onset dementia? Does the person have neurological symptoms? Are they having seizures? Are they getting headaches? We need to think about, has this person had a head injury, or are they on anticoagulants? And the last thing I always think about is, has this person had a history of cancer that is likely to spread and metastasize to the brain? Those points require further follow-up, either a CT scan or an MRI, and rapid specialist referral.
Diana, we need to think about optimising the management of our patient, and we need to think of it in a broader sense with regards to their care and future planning. What's on your checklist for discussion?
I have 4 things on my list initially. The first thing I think about is exercise. I try to get patients who have early or mild cognitive impairment to exercise because we know that's important for their brain health. We know it's important for them to remain socially connected, to be involved in family and activities in the community, and there are some amazing services available. One of the smart things here is to make sure their hearing aids are working so that they can participate in conversation. And then you want to keep them mentally alert. Now, over time, this may change, but things like photograph albums, discussing holidays, keeping their life story in mind so that we can talk about things that keep them interested. The fourth thing I talk about is medication. There is medication for early and mild dementia, but it has modest benefit. But if the patient wishes to explore this, I get a specialist opinion. The next thing I talk about, which is really important, is the enduring power of attorney. This is set up to ensure that the patient's finances and properties are safe, but also that their health and well-being is looked after. So when a patient is unable to speak for themselves, someone that they have chosen will look after them. Remember, when you set it up, you're not actually activating it. You're putting it in place, and activation will occur when it's necessary. That's often very reassuring for the patient. I don't actually talk about the advanced care directives at this point. I know that will become an issue, and I bring that up later in the ongoing care for this patient. I do look at driving and safety issues, because for some patients we need to start to really monitor their safety on the roads. There are a number of organisations and OTs that can assess driving, and if you've got any concerns, to activate that. And finally, I get them connected with my nurse, because she's going to be their first point of call as time passes. So we are going to work as a team to care for this patient.
Dementia can be particularly challenging for family and their caregivers. Do you have any resources that you can share with us to provide further education and support?
We have some great comprehensive overviews in New Zealand. The first one I use is the Health Pathways. They have a wonderful set of health pathways, advice about physical examinations, but also all the screening tools you might need if it's available in your area. The Health Navigator website is very useful. For patients, we've got some fantastic NGOs. We've got Alzheimer's New Zealand, and we've got Dementia New Zealand, who will actively educate, inform and support families and patients. There's been a really good new article out called Mā Te Wharewhare, which is for Māori patients with cognitive impairment, and it gives the impact and support that we can give with whānau and hapu for these patients. I also try to look at WINS, because WINS offers us a number of services for patients. They look at the disability allowance for support that the patient may require. I certainly look at medical alarms, because these patients, if they wish to remain at home, may need an extra level of support. And finally, there is actually a carer support that is available, so I ask patients to look into that. The last thing I look at offering the patients is a mobility permit, because this enables them to go out with friends and family, to go to the mall, to go out and have a cup of coffee, to stay part of their community.
Diana, what are your take-home messages for managing dementia?
Don't panic. I have to say that when a patient presented with dementia or cognitive impairment, I used to feel really overwhelmed as a GP. Having my nurse involved has been invaluable. This is a team process. Being aware it takes time, knowing I have a 3-step consultation process, has really helped me to find a way through the complexity. I've set up my PMS, so I have access to the tools and resources that I need. And finally, making sure that you are connected with your community so you know a little bit more about what is available so you can support patients access the services that they might need.
Thank you, Diana, for coming in today. That's been a really practical overview of managing dementia.
Thank you.